To do a spinal assessment, we do this seated. So the first thing is to make sure the patient's seated correctly. So we need them seated upright with their hands down by their side and their feet straight out in front of them and flat on the floor. Okay, so that's us in a correct position. We can do this sort of seated treatment right from S5 downwards, but I'm just going to show you the actual assessment starting at L5. So what we do is there's L4 there's L5, we put our fingers on the transverse processes of L5 and we ask the patient to bend down to the level of our thumbs. So you go all the way down, and if you watch my thumbs, and you can see that that left thumb has risen. So we ask them to come back up and I keep my left thumb where it is. And then take my pen and I mark where the thumb went up. Now at the moment all we know is there's a problem at L5. We don't know whether it's an extension or a flexion lesion. So I now need to determine which one it is. So what I now do is I ask Murdad to extend over my thumbs. And we're watching my left thumbs there, and you can see that my thumbs have kept even. In other words, it's an extension lesion. If my thumb had gone down on the left, i.e. the same side as it went up, then it would have been a flexion lesion. So if it goes up only, it's an extension lesion. If it goes up and down on the same side, it's a flexion lesion. So we've got an extension lesion here at L5. We then move up onto L4. Now remember that the transverse processes of L4 are well out. So we do the same again. See how my hands aren't gripping the sides at all, and it's just a gentle placement of my thumbs so that everything's free to move. And again, my thumb's gone up on the left. And we come back up, and I again ask Murdad to extend backwards, and again that stayed put, and come back up. So we'll put another spot there. I would continue this all the way up the spine. So if I just choose one here, for instance, if we ask Murdad to go down there, and this time you'll see that my thumbs have stayed level, so there's no problem there. And come back up, and if I just choose something here, and again go down, and there's a tiny amount of going up on the left hand side there, not much. And again if I ask Murdad to come backwards on that one, and again that's staying level, so it's an extension lesion. So I could mark that one. If I now move up to here, and if you go forward again there, and that's okay, and again, and that's going up on the left again, and again we ask Murdad to come backwards, and this time see how that's dropped immediately on the left hand side, and come back up. So that's a flexion lesion that we have here. So here what I would do is I'd mark it in some other way. Personally I just put a little arrow down so I know that that's a flexion lesion. Now looking at where the actual problems are, on the extension lesion side my thumb easily went up on the left hand side, i.e. it's this right hand side that is stuck. Whereas with the flexion lesion, what's happened is it's gone up, but it's gone back down because it's stuck at the front. So we've got this flexion lesion on the left hand side. So with an extension lesion, it's the opposite side from where I've marked, the opposite side to the thumb went up. On a flexion lesion, it's the same side that the thumb went up and down. So here on L4, we've got an extension lesion which is side bent and rotated right. Here up at C6, I've got a flexion lesion which is side bent and rotated left.